Hi there, this is Dr. Evan Osar with the Institute for Integrative Health and Fitness Education. Welcome to this edition of Integrative Movement Insider. And this is part 2 of a 5-part series on working with clients that have common knee conditions, such as arthritis, tightness and or discomfort, and or those individuals that have joint replacements, and also those individuals that just want to keep their knees healthy and safe. Because as I shared with you in part 1 of this series, my sister Sylvia, we just visited her for the holidays. She just had knee surgery 2 months ago. And as I shared with you, she had 0 rehab. And now she's got swelling in her ankle and foot, pain when she walks, and she's not walking properly around the compensations in her knee. So when we think about our clients that have arthritic changes in their joints, especially their knee, think about what caused it. And it really comes down to that one thing we talked about in part 1 of this series. So if you missed that, go back and watch that after this video. It's really their habits. So they create these non-optimal and inefficient habits that lead to degenerative changes, like soft tissue changes of the meniscus and the cartilage, soft tissue changes of the muscles and fascia around the knee, hip, and ankle and foot complex. And then they go have surgery. And then these orthopedic surgeons, many of them say, hey, just go walk and you'll be better. But isn't walking, the habits they created around posture, movement, walking, things like that, isn't that exactly what created their issue in the first place? So how's walking going to solve their problem? Yes, they need to walk, and yes, they need someone just like you to help them develop, create, and maintain more optimal posture and movement habits. And that's why I'm so glad you're joining us in this series and allowing us to share this information with you, because there's so many clients like my sister Sylvia. My brother-in-law Wayne also has knee issues. He subluxed his kneecap, and he was also told by his orthopedic surgeon to go home and rest it and come back in 3 weeks if there's no change in his knee pain. And he got a cortisone injection. So again, how well is that going to work for my brother-in-law as well? And all those millions of individuals that have knee problems and that come to you and I to help them seek solutions because they're not getting physical therapy or they're getting incomplete rehab syndrome for a lot of these conditions, and they just don't know where to turn to. And that's why we share so much free information with you here on our website, on our YouTube channel, on our Instagram page, and through our coursework as well. So thank you again for allowing us to share this information with you and being that solution that your clients and your potential clients need and want. So in part 1, we talked about the 3 things that you must do. Number 1, assess. You have to assess your clients so you identify their non-optimal and inefficient posture and movement habits. Second, you need to address. That's what corrective exercise is all about. You use your corrective exercise strategy to help your clients develop more optimal and efficient posture and movement habits. And then progress. You integrate those more optimal and efficient habits into the functional movement patterns and progress your client appropriately. So you develop more optimal and efficient posture and movement habits, and then you help your clients adopt them into their functional movement patterns. So their bending patterns, their squatting, lunging, and the patterns they need to do for balance, walking, and other functional activities of everyday life. So here in this video, I'm going to show you a very simple assessment you can use with your clients, and then in part 3, I'll show you a very simple process to start the corrective exercise strategy with your client to help them create more optimal and efficient habits. So next, I'll show you a very simple assessment that you can use with your clients and really identify some of those non-optimal and inefficient posture and movement habits. Here's a quick and easy assessment to help you identify your client's non-optimal and inefficient posture and movement habits for standing, as well as loading their knee during a squatting and or lunging type of pattern. Have your clients stand with their feet about hip width apart and just kind of observe their alignment. Where's the weight on the feet, inside, outside? Where's the alignment of their hip, knee, ankle, and foot complex? Now, have your client close their eyes, and if they have trouble balancing with their eyes closed, they can just stand and look straight forward. But don't have them look in a mirror. Have them actually just look straight forward into the wall or just past you. And just have them march in place about 3 times each side. Just alternating each side. Nice and easy. Watch how they shift weight side to side. See if there's one side that's a little bit more challenging. And then have them put their feet back down on the floor and then observe their alignment again. How well, again, do they align their hip, knee, ankle, and foot complex? Because a lot of our clients that have chronic knee issues, they're going to start to rotate their foot out, so their tibia will rotate out and their femur will relatively rotate in. Or their feet may be parallel to each other, but their knee will be rotated in because their femur is rotated in and their tibia is rotated out. And that's the most common pattern we see with clients that have chronic knee issues. Now, have your client, again, not looking in the mirror, just have them move into their best squat position. So put their feet wherever they want for their squat position. Again, observe hip, knee, ankle, and foot alignment. How well do they align the hip, knee, ankle, and foot? And then have them just squat and watch what they do as they squat. Watch and observe their hip, knee, ankle, and foot alignment without any cueing. Just watch what they do. Do they squat symmetrically between both sides? Or do they shift their weight to one side? Because a lot of times our clients that have knee problems, they're unloading that knee and shifting their weight to the other side. You may also see that their foot stays turned out, and now as they're squatting, their knee's going forward maybe, and now their foot's pointed out. Again, another common pattern that will perpetuate knee issues. So look for those common signs of non-optimal alignment and loading. Very simple assessment to look for that. And then in part 3 of this series, I'll show you a very simple and easy corrective exercise strategy to start to help your clients better align and better control and load their knee during their functional movement. So this is Dr. Evan Osar. Thank you so much for watching and tuning into part 2. Now in part 3, as I mentioned, we'll come back and I'll show you a very simple corrective exercise strategy that we use with our own clients and patients here in our clinic to help them start the process of developing more optimal and efficient posture and movement habits. So that way you can then progress them, which will be in part 4 of the series, into those functional movement patterns that our clients need to do to safely and effectively accomplish their health and fitness goals. This is Dr. Evan Osar with the Institute for Integrative Health and Fitness Education. Thanks for watching. We'll catch you next time. Make it a great day.